So, hi, good afternoon, everyone. So, I welcome you all again to our wonderful webinar series, the Curio's Executive Webinar Series on Career Development in the Pharma and Healthcare Industries. So, as we are discussing here, all the potential career options for you with our new institution, Curio. Right. So, in this row today, this is the second episode of the Executive Webinar Series, and today we have the hands-on training on the signal detection, right? And the knowledge what we will getting is from the pharmacovigilance hands-on training in the signal detection, right, guys? So I am very glad to share something with you. As we discussed in the last class, we have come up with multiple short courses in pharmacovigilance, as we are developing pharmacovigilance as one of the major domain, one of the core domain at Curio. Developing the one sec, guys. Let me mute everyone here for some time. Yeah. So we are developing pharmacovigilance as our core area at Curio. Our main focus will be on pharmacovigilance and other parts also, but majorly in pharmacovigilance, we don't want to leave anything. We want to cover everything. Everything means every aspect, short courses, long courses, diplomas, executive courses, and hands-on trainings and everything. Right. So you will be getting a lot of things in Curio when it comes to the pharmacovigilance. You will get one place solution, or under the one roof only you'll get all the solutions, all type of knowledge, all type of learnings in pharmacovigilance area, right? So let me share with you what we have come up in last 1 week, what updates we have for you in last 1 week, because when we had our first webinar, executive webinar on pharmacovigilance and international regulations, we did not have these things, and by evening you will get all the things on the in our website also, right? So first of all, this is our executive diploma in pharmacovigilance 6 months course, and we have executive course also, executive certificate course also in pharmacovigilance, that is 4 months course, right? But along with that, we have something very great for you that I'll let me show you guys. One is executive certificate course in signal detection in pharmacovigilance. That is today's webinar also on the same topic. We have today's webinar, and we have come up with the complete executive certificate course in signal detection pharmacovigilance. And this is a 3 months course. This is a 3 month certificate course. You will get all the things in the Curio website. We are updating by evening everything. Okay. So we have this special course just brought to all of you, executive certificate course in signal detection in pharmacovigilance. Okay. And we have one special hands-on training in the pharmacovigilance safety databases like Medra and all, everything will be covered here. Comprehensive hands-on training in safety databases in the pharmacovigilance. So this is again the short course, 3 months specialized skill development program in pharmacovigilance, right? This is the another course what we have launched, and we have come up in last 1 week. And then we have another executive certificate course in the pharmacovigilance only. Other than diploma and 4 months executive certificate, we have executive certificate course in international pharmacovigilance regulations. If someone wants to learn the international pharmacovigilance regulations in details, we have all the solutions with us. So this is 3 months course, and extensively we will be covering everything. Okay, everything will be covering in this about and international pharmacovigilance regulations, how they work, what they work, roles and responsibilities, challenges, how to fill the forms, how to get this into the PV regulations. Okay, you will get everything. And other than that, the fourth short course we have with us is executive certificate course in aggregate report writing, again in pharmacovigilance. So you will get all type of learnings in pharmacovigilance at Curio, right? So these all are for you. These all four new certificate courses we have launched for you. This is aggregate report writing, and this is again the 4 months skill development program. And guys, let me tell you, whatever four programs we have discussed just now, I have discussed with just now with you at very low cost. Okay, every course, any course out of these four, if you choose, is just at 2,249. Diploma is 3,500. Executive 4 months course is 3,000. And these all four courses, executive certificate courses, are at just 2,249 rupees at all. Okay, nothing much. All four courses, I mean, not all four courses, each short course, if you want to choose any, this is just at 2,249 rupees. Okay, in last 1 week, we have come up with these four all for you. And along with that, we have come up with something amazing for you. These two workshops we are launching, we have not launched yet. These are exclusively right now I'm launching for you. One, our first workshop, 2 days workshop is on data analysis using SPSS. This is the practical approach, comprehensive hands-on training for 2 days, 6th and 7th January 2024, Saturday and Friday, Saturday and Sunday, 6th and 7th January 2024. Only 100 seats are there, and we'll be having 8 to 10 hours of learnings, evening timings, and just at 499 INR. Okay, you will be getting all the details in our Curio website. We'll be uploading these certifications to the website, certificate process to the website. So the entire syllabus will be covered, right? This is the 2 days workshop on 6th and 7th January 2024, data analysis using SPSS, a practical approach. And then another thing we have come up with is let me share with you this 2 days workshop. Again, this is a 2 days workshop with 100 seats, paper writing and publication, comprehensive hands-on training, and 2 days workshop on scientific writing. So this will be on 21st and 28th January of 2024. Okay, still more than a month time is there. Again, it will be 8 to 10 hours of learning, evening timings, and the fees is just 499. This is on the Zoom, right? So you can just immediately learning a complete things about paper writing and publications will be taught, like types of the research manuscript, obtaining a research manuscript, outlinings of a research manuscript, literature search tricks and tips, write a case report, analyze the international format, writing an original scientific paper, narrative review writing, overview, systematic writing, meta-analysis writing, journal selection, research publication, reference management, tools and techniques, everything you will be learning in those 2 days. So whoever is interested, first you can book your seats. So we'll be updating all these things in the website by tonight. Okay, guys, and you can just visit our website at Curio-CTRI.com. Curio-CTRI.com. Let me just share for a bit. You know that website, but let me just share for a moment with you. Here is the website, right? Curio-CTRI.com, and you will get everything in the courses, right? You will get everything in the courses. So with that, I'll let me tell about today's mentors. We have with us Dr. Sarang, and we have with us Mr. Ashish Kumar Verma. He has been interacted with you in the last webinar also. So I'll invite Dr. Sarang and Dr. Ashish to introduce themselves one by one, and please go ahead with the webinar, guys. Thank you very much. I welcome you all again.
So thank you, Dr. Ajit, for giving us this opportunity. So yes, I would like to introduce myself. I am Ashish, as I working from last 1 decade in PV industry, and today we are taking care of the session of signal detection, hands on the signal detection. We will just touch the brief of the signal and how signal is important in the PV industry. So Sarang, would you like to introduce yourself? Sarang, you are on mute if you are speaking.
Ashish, sir, your audio is not that great.
Okay, right now?
Yeah, it's fine. It's fine now. I mean, a lot of wind type of thing was coming.
Okay.
Yes, Dr. Sarang, can you hear us? Yeah. What's her name? I'm so sorry. Maybe he's unmute. He cannot. One sec. What's her name, Dr. Sarang? So we can make you. Yes. Okay. Okay. One sec. One sec. I think yeah, right. Okay, can someone make him co-host? Yeah. Yes, please, Dr. Sarang. Please unmute yourself. Please go ahead. Now you can. Please unmute. You can now.
Okay, Sarang, can you speak? So, guys, when let give this arrangement to Sarang, give them some time to him. Meanwhile, guys, it would be not a monotonous session. It would be a two-way communication. You guys are not only the audience; you have to participate in this session as well, because it would be two-way.
Yes, I have opened the mic for everyone so everyone can talk. Ashish bhai, please unmute yourself and go ahead.
Hi. So, hi everyone. Good evening, good afternoon. So, guys, before we start this signal detection kind of thing, so it should not be a monotonous session, and it is not the only host is speaking, and it would be a two-way communication kind of thing. Okay. So you also have to learn something, and I also have to learn something from you guys. We have to know what is your expectation from this session, so that we will include all those things if we have missed something in the upcoming courses. And guys, please speak up, yes, 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 as yes, if you are able to listen me or understand me. Guys, please participate. Are you there? Let me take the names of
Yes, sir.
Saran. Can you share your screen, please? So, like,
Sir, your audio is not very clear, but yeah.
okay, right now.
Yeah, actually, a lot
There
of
is
like
some
blowing like
background noise.
sounds
There
is
is some
coming. Yeah,
background noise, Ashish bhai.
yeah.
Okay,
Yeah, right now it's okay. I feel yes.
okay. So when we are talking about signal, Sarang, can you share the screen? I guess he was the presenter on.
Yeah, he's sharing. It was coming like yeah.
So when we are talking about the signals, anybody have any idea what a signal is in PV? So it is similar as the signal when we are talking about the layman language. Signal is the signal. Whenever we see the railway tracks, the signal are the signal which guides the train. That what is the correct direction for the train? What is the right way where to follow the track, and
Ashish
which
bhai,
track?
If you are wearing the earphones, please remove because the audio is not at all clear. A lot of noise is coming.
Oh, no, I didn't use the headphone right now. Can I use headphone and then check?
No, I think now it's fine. When I'm speaking to you and you are speaking, it's fine.
Okay,
Yeah, now it's fine.
okay. So when we are talking about signal in PV, what is a signal is? Signal is working as an alarm. Okay, it is an alarm which guide us whether we have to take care take the alert situation, or any finding which is already known, but there are some aspect of that known finding is unknown previously, or a new thing which is already not known up to the mark, or it requires some argument or justification kind of thing. So those are called as the signal in the PV. uh, Wait a minute. I didn't get the screen as well right now. So when we are talking about the signal, what we are talking that what are the importance of signal, as we are saying that signal is like, yes, now I am can see the screen. Can you go it to presenting mode? Yes, when we are talking about the signal, so it is like everyone is interested in signal. Why? Because all the regulatory bodies have given their own definition for signal as well. Why? Because when we are talking about the SIOMS has given some information, like what is signal. Signal is the information that arise from one or multiple sources which suggest a new potential causal relationship or a new aspect of unknown. What I was saying at previously, either it was known previously but some aspect was unknown for that particular situation, or it was completely unknown. So that kind of thing is called as a signal as per this SIOMS. And again, new hazard or any known hazard, that is a quantitatively or qualitatively different from the previously existing one. Okay, when we are talking about the hazard, might be possible the previously the frequency of the ADR is some different, but now the frequency is changed. So if there is any change which give any potential thing or potential knowledge in the judgment of any situation, that is also defined as a signal. According to WHO, what is signal is reported information on a possible causal relationship between an adverse event, the relationship between unknown or incompletely documented previously. Same. So everybody, the everyone is everyone is saying same thing, but the way of saying is different. So can you go to the next slide, please? So in PV, when we are talking about signal, so in PV, a signal is more than a statical association. Why statical association? Because it is not a data, it is not an statical data, but it is relevant because they are going to the depth of the PV, and they are always awaiting the new uh, findings for any ADR which is already there, or for any drug which is already marketed. Might be possible that paracetamol is there for last how many decades, even we don't know. But there are certain aspects which are not known to the known to the globe, because we are using it, and we are using it as an NSAID. But might be possible there are certain other unknown or other hidden can say efficiency kind of thing is there, which would be not known to us in the general public. And when it comes to the knowledge of general public, that becomes as an ADR, or sorry, become as an signal. So again screen is stopped. Can you share again? So when we talking about the process of signal, how we will do this signaling kind of thing. So there are steps, process of signal detection, in which we validate whether a signal is valid or invalid. We assess a signal, whether what is the potency of signal, what how much it can impact, whether it can impact the human life or not. And one more thing, signal cannot be justified based on only one report or only one ADR. We should require at least minimum of 3 reports. Based on that, we can declare any new finding as a signal, because signal can also give an alarm to the regulatory to take the further steps, what steps need to be taken. So that kind of thing cannot be justified with only single report. So at least we require 3 reports for the, like we have an example where
My slides are not visible. Everyone, is it visible to all of you? Slides
No,
are
sir, it's not visible.
slides are not
It's
there.
not
No,
visible.
sir.
oh, okay, stop. Sarang, can you check please again? Sharing is stopped.
I think he's not in the meeting, Ashish bhai.
Oh, okay. So
Can you share with us so we can share from our side? Is it possible?
yes, it is possible.
Guys, so sorry for inconvenience. Just 2 minutes. Give us 2 minutes.
So Dr. Ajit, I have shared it to you on the group, and please, you can, if you can present.
Which page, Ashish bhai? Which slide? Tell me. Just I'll share. 1 second. I'm
You
sharing
can share
on.
second
Yeah,
third slide.
yeah.
Or
Just let me see. Yeah, it's opening.
so guys, when we are talking about signal, so as I told that it again, it is not a one day process, and it is not a single step. It required the various steps. So what steps are included in that, we will see in the PPT or presentation. Just hold on, and I will define you all the steps one by one. So meanwhile, you can understand that signal is the finding which is was previously completely unknown, or it was known with half information. And we are come up with, yes, slides are visible. uh, Go to the
Yes.
next slide. Next slide,
Yes.
please. So yes, this was again missed. So when we are talking about signal management, so whatever the signal activities we perform to get any signal is called the signal management thing. And how we manage signal, from where we got these information. For that we have these databases where we have to extract the information. What we do, we perform a search string. Like, for example, if you are searching any novel thing, like, if diclofenac has created a bladder cancer. So if you are checking for these reports, so what you have to do, you have to just uh, check with the database. Why in database? Because all these database have all the historical data. Like, for example, here we can see the Uppsala Monitoring Center have their own databases, that is VG Flow or VG Base. So whenever they required any information, they navigate to their databases and they extract that information, whether diclofenac causing bladder cancer, is there any information regarding that in their database. If it is not there, then they could consider it, that like first step is passed, because it is not known and no report is found in their database. So might be possible there is a chance that it would be a signal kind of thing. Okay. So same way every database have billions of reports. Like here it is mentioned that WHO database has already 2.8 billions of spontaneous ADR report. Okay. And we need to know whether the drug and ADR, it is known or not, or it is the pair. When we are talking about the signal, whether the same pair we require to be searched, or it is a different pair. Like, when we are talking about ADR and drug pair, it should be always different. It should not be known which was previously mentioned in the database. Okay, go to the next slide, please. Yes, this is the process of signal management, which I was talking. Like, signal detection is the first step. First we have to detect whether it is a signal or not. So when how we will detect? We will just extract the information in databases. If it is not there, then we could consider it might be possible a potential signal. Then we need to validate it. How we will validate it? We need to, as I told, on the basis of one information, we cannot consider it as a valid signal. At least we require minimum of 3 report. Okay, because we have to take a strong judgment. We have to send these information to regulatory authorities, and regulatory authorities have to issue the warning alerts to the already already drug present in the market. Because if it is taken without that alarming or without that warning, it may be harmful to the general public. And after the validation, that signal analysis and prioritization. What we do in analysis? We will check whether the what is the uh, till what extent that signal is impacting to the patient. And prioritization is depend on uh, that analysis only. Why? If a signal might be possible, that if a signal is causing death or it is life threatening, then the prioritization is on the utmost priority. But if it is not causing that much in depth kind of thing, it is not causing that incident, it is just a harmful effect, so we can delay the prioritization. Signal assessment recommendation for the action. So again, when we are talking about signal assessment, we have to assess what kind of the signal it is, whether it is impacting the human life, whether it is impacting the respiratory system, which part of. Okay, whether it is assessment. Again, it is particular to a batch. Might be possible when companies are manufacturing the drug, it might be possible there is one batch which is which have some malfunctions in the machines. Because of that, faulty batch has uh, issued in the market, so might be possible. So we need to assess that kind of thing, whether it is a malfunction kind of thing during the manufacturing, or it is associated with the drug only. There was no malfunction reported during the manufacturing. Okay, so if there is no malfunctioning associated during the time of manufacturing, then again it could be a pass for the signal. But if it is a malfunction kind of thing during the manufacturing or any during the transportation, might be possible drug degraded because of the excessive heat while the transportation kind of thing, and due to which the drug is not able to deliver the thing, or might be possible some carcinogenic or some other dust particle could enter in the drug packets, and it causes the that it is harmful, or it is causes the injurious effect to the body. Because of that, we cannot consider is a signal. So that kind of thing has been assessed during the signal assessment, and whatever the recommended action, we the person who are assessing can set what recommended action should be taken, and that recommended action should be reported to the authorities, that it is the associated risk in the signal, or
Hello.
it is a signal, or it is not a signal. And like exchange of information is kind of thing, when we come to conclude that yes, it is a potential signal, then we exchange that information to all the authorities, and authority now up to the authorities what kind of actions they are going to take in future regarding that signal. And if it is not a signal, then also we will provide what is the justification why we are saying it is not any signal, although it was come to us like as a signal. But if we are degrading it as a, or downgrading it as a non signal thing, so we have to again provide the justification, and that information again we will communicate to the regulatory authority, or the report from where we received that kind of thing, means the source or reporter kind of thing, from where we have avail that information, we have to justify that to them. Go to the next slide, please.
Ashiji, just want to add a few
Yes,
things.
please. Yes, please.
Yeah. So, hi everyone. Sorry, there was some network issue from my side. Yes. So regarding the signal detection, a number of factors which are discussed by Ashish, these are to be taken into consideration. Okay. And most important is not only the quantity, we have to focus on the quality of the report also. Apart from that, how many cases we have get report from the healthcare professional or non-SCP, or we got a literature. So it should be based on the volume actually. But again, it depends on the severity, seriousness, whether the incidence is very rare or very common. So we have to take all these things into consideration, and then only we have to think that this is a signal for particular drug. And once we finalize that this ADR, we have to consider it as an signal. We have to start the process of signal validation. Okay. So once we finalize that this is a particular signal, or the ADR which we can count as a signal, then we have to start the process of validation. In validation, we have to assess multiple factors, including the causal association of the particular drug with the mentioned ADR. If the causal association established and other supporting data is very clear and significant, then we can state it as a validated signal, right? But uh, if there is no significant information, lacking of information is there, or we are not able to do the follow up with the reporter or patient or the healthcare professional, or ambiguity in the source data, then we cannot say that this is a valid signal. Causal association we cannot establish, right? So these are the steps of validation of the signals. Then once your signal gets validated, Then the next step of signal analysis, assessment, and process starts. Okay, so once during the assessment, we have to go into the depth of the particular area with the mentioned drug. We have focus on frequency, number of reports received in a particular duration, either in quarterly or yearly basis, or we have to collect the retrospective data also. So we have to analyze, we have to conduct the retrospective data collection, either from the medical health records or from doing the survey retrospective research studies, and try to get the information from the community. If causal association established, then we have to proceed further. But if there is no causal association established after the signal validation, then we have to say it as a refuted signal. Okay, so refuted signal is a signal when it passes the level of signal validation, but at the time of the further assessment, causal association is not established at that time of point. Okay, when, for example, drug acts on multiple some ADRs, either one or two, initially or earlier it was known to the community, but there is increase in the number of cases, increase in the frequency, and increase in the seriousness. But when it was determined as a signal for the validation and assessment, particular timeline is fixed to keep that ADR into surveillance. Retrospective study is also considered, and for next upcoming 6 months or 1 year or 2 year, it should be under monitoring. And in that duration, if there is no similar report are reported by the healthcare professional or physicians or consumers, or there is no incidence of such ADRs again, then we have to say that there is no causal association with the particular event with the drug, and that's why it should be called a repeated signal. Okay, over to Ashish.
Thank you, Dr. Sarang, for adding. Can you please move on to next slide? So when we are talking about signal management process, there are certain significance as well. Like what are the significance, why we are doing this signal kind of thing? Can you go to the next slide, please? Yes. So what happened while there is a significance? So it is like early detection of ADR. When we come to know that there is an causal relationship kind of thing is there, and when we come to know that there is an ADR is associated with was not known previously. So with the help of signal, if it is marked as a signal and we can communicate it to the general public, so it will be easier for the public as well to get the new ADR as a known ADR. So again, it is issuing a warning to the public, general public, for their health. Okay, and it again changed the benefit risk ratio, because previously it was unknown risk and now it is known risk, so everyone can take the vigilant actions regarding that associated risk. And like scientific and educational values are there. uh, what happened when we are saying that there is a signal, so it is got published everywhere. Sometime what happens, like if any drug is like firstly introduced in the market, firstly get authorization for marketing, at that time what happened, that it might be possible there was no studies happened in that country. So for that we have to take the educational thing, or we have to take the reference from the education or scientific literature. And also, if we got any new signal in our country, then we are going to publish it in the educational material for others reference as well. Okay, and again, that signal provides an strong evidence for an ADR to be associated ADR. So that kind of thing is the signal management, significance of signal management. Go to the next slide, please. I guess over to you, Dr. Sarang, for the steps of signal detection and all.
Yes. Thank you. So, just in continuation of the previous slide, uh, when there is a change in the risk benefit ratio, uh, it has to be assessed thoroughly, and we have to inform to the authority. Authority try to get the additional information from the different marketing and evaluate the signal with the information. If similar reports are received from the other method, and authority consider
Voice, Dr. Sarang, your voice is not clear.
hello,
Yes, now
Yeah,
it is
now,
coming.
am I
yeah,
audible?
yes,
Now
now
it
it is fine.
Okay,
Previously, it was
okay.
breaking.
Okay. So we have to, if there is a change in the risk benefit ratio, we have to inform regarding the signal to the health authority. Upon that, health authority take a action and call the data from the rest other MH and evaluate the same data. If similar findings are received, then authority take up action and declare it as a signal. Upon the declaration, uh, each and every MH going to change their RSI or the investigation brochure or what we call it as a SMPC, and update within the stipulated timeline and circulate to the authority and for the common public also. So this is important point. Then for the scientific and the educational value, Ashish already told you, but sometimes there are drugs which are used in rare medical conditions or the situations. So in such scenario, we have to generalize the clinical trial, or we have to involve a number of public or the population to get maximum number of cases, right? So in that way we get the additional information regarding the signal assessment. Yes. So next, that is signal detection tools used in signal detection. We have to utilize the electronic data which we have received from the monitoring report, that is ERMR. Okay, so this is one of the source where from where we can pull the data regarding the particular ADR with the mentioned drug, and we have to evaluate the severity, causal association, frequency, and seriousness. So on that basis we can determine the causal association, and we can say that it whether it will be uh, cross the validation process or not, right? Another is the ultra vigilance database, that is advanced. So in the EU region, we pull the data from the ultra vigilance data analysis system, again to assess and validate the signal. Next slide, please. So in this part, we are discussing and just focusing on the why signal is important, what is the importance, and why it is required in the pharmacovigilance sector. Uh, I think everyone has heard about the thalidomide disaster. In the around 1960 or 1962, there was a disaster due to the thalidomide. Pregnant women consume the medicine and give a birth to the uh, babies with a congenital anomaly. Okay, so from that day, there is a till date there is a continuous improvement in the pharmacovigilance process, and each and every small aspect is taken into consideration when before giving authorization to any product for the marketing, and even after the approval. Authority continuously watching the risk benefit ratio, and on that basis only further approval or the revision of the approval is dependent, right? So due to the thalidomide disaster, there is a huge revolution in the pharmacovigilance industry, right? That's why signal is important, because at that time thalidomide was given just for the morning sickness, to cure the morning sickness. But no one knows the outcome of the pregnancy if mother gets exposed to the thalidomide during the pregnancy. But within a short span, congenital anomaly was noticed in the newborn babies, and that's why.
Oh, okay. So you are Redmi 9, right? Please open your mic. I'm so sorry. I just thought someone else is speaking, so I just put it off. Please.
Okay, okay. Yeah. So, uh, am I audible now?
Yes.
Yeah. Okay. So, that's why thalidomide was withdrawn from the market, and signal was generated for the thalidomide. Sometimes we in with the drug we cannot always say that each and every ADR or the adverse drug reaction or the adverse event is responsible to generate a signal, or each drug is responsible to cause only adverse drug reaction. Sometimes you get a unexpected therapeutic benefits also. For example, minoxidil. Minoxidil is basically meant for hypertension. And when patient started taking the tablets of minoxidil, experience that there is a unnecessary hair growth on the body. So within very short span, multiple cases were reported, and later on, proper study determined the causal association, and it was identified that yes,
So, Dr. Sarang, you are lost again. So, what Dr. Sarang was saying that mixodril is a drug which is used for some other purposes at that time, and when we come to know that there is a unnatural hair growth in all over the body, then what happened? That it is an off-label use, and right now that drug is in the market, and you can see that most of the time when people are facing the issue of hair losses, so it is as prescribed with the physicians right now. So it is again a beneficial kind of thing, or you can say off-label use of the miscrodil, which was previously unknown to the public. But what happens because of that tragedy which happened in the history, it bring up the beneficial effect of the miscrodil as well. It was not beneficial at that time because it was not used for the hair growth in the body, but we have taken into the consideration that there is an associated risk of hair growth in the miscrodil. So how can we get it into the beneficial kind of thing? So beneficially we use when people are facing hair loss situation in the early age, not in the elderly age, but in the early age, when like nowadays it is very common, people are going towards the hair transplant and everything. So you can see whenever there is a doctor who is prescribing for anything for hair loss, they must be prescribing miscodil. So yes, Dr. Sarang, if you can add on.
yes, yes, sure. So from that date, multiple clinical trials were conducted, and it was identified that minoxidil is very effective for the treatment of alopecia. And instead of giving the tablets, different formulations were came into the market, like shampoo, oil, uh, cream, like that, and just to apply locally, and it was giving up excellent results. So this is again a signal for the minoxidil. And just want to add one more example, is metformin is very commonly used drug for the type 2 diabetes mellitus. But few reports are received regarding the uh, correction of the white patches, which are usually commonly found in diabetic patients. Okay, so it causes the pigmentation, increases the pigmentation, and the normal tone of the skin is reappeared with the metformin. So this is the unexpected therapeutic benefit, but it is really helpful for the patients who have the leukoderma, right? So moving to the next, that is a role of AI in the signal management. So almost since last 1 or 2 years, there is a uh, boom of AI. It is get introduced in each and every field and reducing the requirement of the human beings. So it is already entered in the PV system also. So there are f- pros and cons of entrance of the AI, right? But as we are a human being, no one can challenge us and our capacity. But for that, we have to be very thorough with our knowledge and the skill to overcome the AI. So AI supports in the signal management is reduce the time cycle. Usually to evaluate the data of last 3 to 5 years, right? It take too much of time. And for the signal reporting or the signal management, periodic cycles are already shared by the health authorities on which date they are expecting a final report from the particular MAH. So it is a really a tough job for the pharma industries or the CROs to evaluate the whole data and assess each and every case, and then consider whether this signal is validated, non-validated, or refuted, like that. So it took too much of time. But with the AI, it reduces the time to a maximum extent, as it evaluate the data very quickly. There is no need of any support from the human being. The programming is in such a way that it evaluates the ADR whatever given in the case or in the uh, respective field and assess the causal association. Then improve the quality and the accuracy of the information. Usually when a human being is working, there might be a different thought process, difference of opinion is there. But when AI system came into the picture, it usually decreases such kind of bias and give a authentic and proper report. Accuracy is more. Then handling of the diverse type of data formats. For example, if we are to get hands-on on a particular type of the document or the information, we have a training, right? But for the AI system, they don't want any kind of training. They can evaluate the data very quickly. And last is identification of the ADR's causality and the seriousness. Whatever kind of data is provided to the AI system, they evaluate as per the command and get it done within a very short span. Okay, so this is the role of AI in the signal management. Last is the challenges in the signal management. Challenges are again because we have to evaluate the very huge data of almost 3 to 5 years. So quality data collection is very difficult. Okay, after collection, we are not sure whether it is appropriate or not, right? Or we can say it as a authenticity. For example, for the true spontaneous cases, true spontaneous cases are those where consumer or the healthcare professional directly report to the toll-free number that due to the particular drug patient experience ADR. Okay, so we are not sure. We received just a mail or either telephone or fax, like that, but we never saw that patient, right? So the authenticity is one of the question. So this is one of the important challenge while dealing with the signal management. And another thing is the reproducibility. Means today you are come up with the uh, drug ADR pair, that is for example drug X is causing particular ADR, But if you are continuously monitoring for next 6 months or 1 year, there is no such report. And even for next upcoming 5 years, there is no such report is identified. So we cannot say that this is a signal, right? So reproducibility of the particular data is very mandatory. Otherwise, we cannot do a proper signal management. Okay, so this is from my side. Ashish, do you want to add anything from you?
Yeah, like for authenticity, as I already told, authenticity and for reportability, that reproducibility, sorry, that actually we required, we cannot trust whether the call is fake or whether it is. We need to evaluate. That's why we are conducting follow-ups so many times. Okay, when we have incomplete information, we conducting the follow-ups in the industry is a practice that when we required more and more information from any patient who have given the telephonic call and they have reported such any ADR. So for validating kind of thing, we do follow up kind of thing, and follow up again required. It depends whether we have the authorization for 3 follow-ups, whether we have authorization for 5 follow-ups. So that kind of thing happens. And as I told, that a single report cannot be considered as the signal, because it do not give the potential evidence for us. At least we required minimum of three reports, so that we can conclude that this much be this ADR and this drug pair can be event pair can be considered as an signal. So that's all from my our end. Like for technical parts, now mics are open for all of you for your queries, for your any career concerns. So Dr. Ajit is also there. Yes, guys, over to you.
Yes, guys, thank you very much, Dr. Sarang and Assis. Accepting that we had some technical issues, but I believe that it was a wonderful session. It's a great session. So, guys, over to you for your questions now. Yes, guys, please ask the questions if any. Guys, no questions? Really? Is it?
So guys, like for career perspective, I can guide you. Like people are saying that we didn't see the vacancies of signal, and we always see the vacancies of ICSR processing or case processing. So how signal is playing important role in PV. So actually what happened, why we require bulk of case processing associate, or why we required people who from ICSR background, because we are archiving data from general public, we are archiving data or gathering data from every sources, from marketed drug which is market in the market. So that's why case processor are required in more number, because we are getting bulk data, and we need to extract each and every information to our database. Then only signal people can work on those data. They can extract the information, they can get the information required for any specific event drug pair. And so that's why the number of people who are taking care of the signal management are less. And that's why the demand is more, because when supply is less, there would be more demand in the organization. So very rarely we get the people who are from the signal background, or and we have very worst knowledge of the signal. So that is very rare. So we are here in Curio, we are creating gems of signal, or champions of signal and aggregate reporting by our courses.
Absolutely. Absolutely. Yes. Yes, absolutely, guys. So, any questions, guys? Please ask your questions if any. Okay, there are questions. Asis bhai, can you please take it?
Yes. So I can see there are. Sir, can you please elaborate how is reporting actually done? So yes, we have included all this information in the courses. So you have to get to for that, or if you do not want to enroll, you can just check the reporting requirement for each and every authority, for which authority you are looking for. You will get it. And
Yeah.
what are the aids for AI in the signal detection. As we told that AI is playing a major role, whatever the information a manual person can extract in 2 days or 3 days, because we have to deal with the frequency reporting for and when we are talking about the frequency reporting, it much have like 6 years of data or 5 years of data, because the when we have to perform the frequency reporting in the continuation of the previous one, so it is particularly like 5 years of data. So we cannot extract the 5 year data in a minutes, but AI can do. So, sir, please can you elaborate how? Hello, sir. Can a fresher join the PV field? Yes, absolutely. Freshers are very welcomed in the PV industry. Even they are working, they can join as a like PV associates, and the salary is ranging from the 3 to 5 lakhs, and it is increasing day by day. Okay, so it is increasing day by day, so career are very bright for the students which are want to join PV industry. So, and we are here in the Curio as well, we are guiding each and every aspects, even we have the interview guidance kind of sessions in the courses. So any more questions?
हेलो सर, एक्चुअली आई वांटेड टू आस्क यू कि लाइक एआई को सिग्नल डिटेक्शन के लिए कुछ एल्गोरिदम्स प्री डिटरमाइंड है कि लाइक खुद ही लाइक इफ यू आर इन सिग्नल डिटेक्शन खुद ही क्रिएट करना पड़ता है कि ऑलरेडी वो पैरामीटर्स है, और है तो क्या क्या
No,
है वो पूछना
what
था.
what we can do, we can create a search string for the time period. Okay, if you require any search more information, you need to include, you need to keep updating your string as per your information or as per your knowledge or as per your demand. Okay, means whenever you required the drug event pair, you need to save the that search string. And like if you required for example, if you required from 1990 to till 2003, then you have to feed the date in search string only. You else how can it extract the data for that specific time period? Okay, got it. So you need to, AI is there, but we have to train the system so that they can play their role. So every time human intervention should be there, so that we can train the systems as well, in the form of coding, in the form of instructions. So every instruction should be there, and that should be performed by human only, then only AI can help to the helpful for us. Like what robots are doing, they do not do anything without the command of human being. That's how same AI is there.
Yes, I just want to add one more thing. Initially, in means currently also in most of the organization, line listing is pulled manually, and after that, it was evaluated by the PV associate, and then medical reviewer is taking care of all these things, whether coding is done properly or not. But here, AI can support and reduce the manual efforts, but for that we have to give a proper command to the database, and we have to extract the data appropriately. Then and then only we can take a help, we can rely on such kind of data. Otherwise, again, manual intervention is mandatory. Okay,
Any
does
other
anyone
data?
have
Any
any
other questions?
question?
No, I don't think so. So, guys, thank you very much for joining. Thank you, Dr. And thank you, Dr. Sarang, and thank you, Ashish Bhai. Thank you, everyone, for joining this session, wonderful session. And see you on 13. I think our next session is on 13th. So be alert, be there. Next session, we are now starting with the new domain of medical writing. So please be there. And thank you very much. No feedback forms. We are taking your attendance. Whoever is in the Zoom class, we are taking all the attendance. My team is taking the attendance from backend. Don't worry. AI. Okay. Yes. Take care, guys. Bye bye. See you.
Thank you.
Thank you everyone, bye.
Thank you, sir.